Thank you, Greg. Hi, everybody. How's everybody doing? Excited? We have a very exciting talk coming right now by Dr. Christos Kontovounisios. I'm very happy to introduce him. He's a surgeon practicing here in Athens, Greece. Dr. Kontovounisios, the floor is yours.
Yeah, thank you. Yeah, good afternoon. I don't know if you can hear me well, but excellent. Okay. So thank you, George, for your kind introduction, and many thanks to the committee for inviting me here on this forum. I can't say that this is my bread and butter audience. I'm a surgeon. I'm not a bioscientist, but I'm very happy here to be today and maybe give you my perspective as a surgeon, how we, through the entrepreneurship pathway, we can maybe influence a healthcare system or how we can improve our patients' outcomes. So a little bit of background about myself. I'm a general surgeon. I finished my training in Greece. I left in 2011. I went to London. The plan was to stay with my wife. She's a surgeon as well for 6 months. We ended up staying for 15 years. We have 3 children. And I followed the pathway of what we call colorectal surgeries. For the ones that they don't know, it's anything that has to do with the gut or the bowel. So I did my training in robotics, in laparoscopy, and I also ended up doing something called exenterative surgery, which is multivisual resections, big operations that they take up to 20 hours, to complete them. So 15 months ago, I decided to come back to Greece. I accepted a role in a public hospital. I was really happy for this. We did quite a few innovative things, even if it is a public hospital where the bureaucracy is a little bit difficult. We even performed quite a few of those operations for the first time in Greece. A couple of weeks ago, I decided to resign for many different reasons, but I have a genuine interest in innovation, in leadership in surgery, and entrepreneurship as well. So I'm going to give you a couple of examples of what I've done and how that had an impact in our patients. So when we think about an entrepreneur, and most of you are here, I guess, we think about someone who takes an idea, a venture, and then it leads it to success. And it's very much, this person is characterized by independence, autonomy, and also to control the whole process to become a success story. And this is how you would actually describe a surgeon as well. We are very similar in that way. It's very important, entrepreneurship, for many different reasons, as you know. But when you do, you see why entrepreneurship is important for physicians or clinicians. Among this big pie of trillions for the total health expenditure, the services coming from us, it accounts for 20%. This number is coming down as well. So we are not known to diversify ourselves, like we diversify our investments, for example, or our income, and we don't have the ability to earn equity outside of what we do day to day. There has been a massive economic shift away from physicians. This is an example of an orthopedic surgeon earnings and a CEO of the hospital. It was really terrible back in 2015. It's getting better now. But if you think about what a natural entrepreneur should be or look like, I would say it's very much like a surgeon. We do know how to work under pressure. We can lead teams. Let's think about OR. We can develop processes, pathways, workflows for our patients. We can persevere under pressure. We can identify unmet needs, and we can become really credible within our community. But if you see the top 10 leaders in, let's say, orthopedic companies, none of them have a medical background. It's all about engineering, finance, business, and so on. So what are the difficulties we have as surgeons or clinicians? I think we are very heavy on duties. This is number one. Number two, we have never had the experience to have any business. I think it has been discussed on the previous panel as well. We don't have knowledge about how to run a business. We are also trained to be risk averse. We don't want to take complications. We don't want to have risks. And especially surgeons, they have this do-it-alone attitude, especially if you operate in theaters. We don't have mentors to teach us about business, and we don't have the liquidity or the finances. There are some unfair struggles or barriers, such as prohibition on physicians or vendors. I have friends that they had to give back their medical license in order to sell their products. And also, to be fair, there is some prejudice in the business community of surgeons, how can they run a business. Now, there have been successful stories. You can see my colleagues here. These are very, very good success stories. I was involved a little bit on the TAT surgery startup, which is really fascinating. But how do you get started if you are a surgeon or if you are a physician or a clinician? How do you move from this environment, which is very heavy, to a business idea? And I would say the most important thing, someone told me, is you have to make time. You really need to isolate half a day a week. You sit in your office, you isolate your mind from anything else, and you work on your business idea. This is me operating on a patient. It happened that Channel 4 came to do a documentary, and we were not able to save the patient. So that was a dad of two that unfortunately passed away. It's very emotional. It's very difficult what we do because we deal with lives. And if you really want to succeed on a business idea, you have to manage to negotiate these emotions. You have to wear your business hat or your idea hat. You need to be on a very positive spectrum. You need to plan, you need to judge, and you need to invest. So you really need to focus on this business idea. So my first example is an innovation we implemented in a big hospital in London. It's called Chelsea Westminster Hospital. It's northwest London. It's part of the Imperial College campus. And it's all about the using of tools such as PROMs and PREMs, which are essentially questionnaires that the patients are asked to answer for us. PROMs relates to outcomes, PREMs to patients' experiences. So it's all about this new paradigm of moving the patient in the center of its treatment and have a voice. And we all know that these tools, these questionnaires, have many benefits in many different levels and experiences as well. Many countries, many health systems have implemented these tools within the healthcare process, and they are trying to meet needs that they have to improve their services. And in UK, it was up until 2008 when Lord Darcy said something very simple. You cannot really make changes if you cannot measure, if you don't have data. So the NHS, the National Health System, asked from all the hospitals to report back these questionnaires, the answers on these questionnaires for 4 different conditions: the hip, the knee surgery, varicose veins, and hernia. And this way, the head of the NHS can sit on his laptop, choose one hospital, and really see how they perform. And also, the consumers or the patients can also report back and feedback about the services. It could be a consultation with a doctor, it could be the porter, or how clean is the hospital, and so on. So in my practice, I was in charge of the colorectal service. That means about 20,000 patients per year. And when I started running the service, we had paper-based questionnaires whereby we had to collect them. It was really difficult, very fragmented. It was absolutely chaos. We couldn't collect any information. So my idea through the Digital Health London Accelerator, which is a program that links scientists, clinicians with startups, I found a company called My Clinical Outcomes, and I developed a platform where we divided all our patients in 5 domains: the ones that they come for a one-day procedure, let's say hemorrhoids, the ones that they have cancer or bowel problems or inflammatory bowel disease or any other. And what we did differently is that we used disease-specific questions. We used general quality of life questionnaires, and also a decision regret scale questionnaire to identify whether the patients have changed their minds. This way, you could get real-time data flowing continuously, and you can evaluate your service at a consultant level, at a physician level, at a team level, at a managerial level, and make changes, which is quite unique. So the data starts from the patient, it is analyzed within our team, and then we feed back to the patient through the NHS app, which is really satisfactory for the patient. It feels that it contributes. This way we were able to digitize the process. patients felt much more involved. We were able to bring patients back to the hospital if they don't answer the questions the way we like it, because we understand that they don't do well. Equally, we can move patients further down the line to be seen after a few weeks. So we made the outpatient flow much, much better. Also, we generated a tool for the general practitioners to direct patients in the hospital in a specialized service, and we did some quality analysis. So many, many, many benefits just by digitizing the data. Let's move on to another example. It's the National Bowel Screening Program. Some of you may have received a text to contribute or go and have this really, really important screening process that has been implemented recently in Greece. I was asked to be involved with the bowel cancer screening program. If you don't know, the cancer is the leading cause of death in Greece, and that has been for a couple of years now. We used to blame COVID because we lost 2 years of diagnostics, and patients used to refer to us very late. But if you ask me, I think it's lack of a stratified approach to cancer and lack of epidemiological data in the country. Early detection is not really well established in Greece, and once is diagnosed with cancer, I think there is big discrepancies on the quality of service we provide among different institutions. Whether it comes to quality of life or well-being, this is not even touched in everyday practice. So I had to come up with an idea that patients will engage. You know, the number one reason why a screening program will fail is non-engagement. So you need to motivate someone to do the screening. And think about Greece, we have many islands and geographically many small villages. So we can't really send our stool to a dedicated lab that we don't have many anyway. Nobody will do it. So what I came up the idea with is to use pharmacy as point of contacts, because everybody likes its pharmacist, and also self-test. So essentially, you get the message, you go to the pharmacy, you get a self-test. If it is positive, it doesn't mean positive for cancer, it means positive for stool, but that's how you can stratify your population. And then you go back to the pharmacy, you get a free of charge ticket to go and have a colonoscopy. So everything is done free, and this is how you change the mentality nationally, because this is a dynamic process, but equally you collect data, so you can see the prevalence and the incidence of cancer in different parts of Greece. Therefore, you can do what we call a better operational management of your resources. You can move, let's say, a CT scanner or a gastroenterologist to do a colonoscopy, or you can even move your physicians, which is hopefully this is the end game of this process. So we know that early detection saves lives. I've operated at least 6 patients that had absolutely 0 symptoms, but the test was positive, ended up having a colonoscopy, a cancer was detected. So they will have a 100% survival rate after 5 years. And from business perspective, it's definitely beneficial, cost beneficial to detect early. These are last week's numbers, and we are very much aligned with other European countries. It's good to compare Greece with other similar population like the Netherlands, and it's all about changing the mentality. It's all about engaging the population. So please do your screening on all the different types of screening programs we have. So if you ask me as a surgeon, what is the key of success? I would say it's yourself. You need to believe on your idea and yourself. An average idea with a great execution is better than a poor idea, better than a great idea with poor execution. You need to identify the opportunity, how competitive your idea is among others, and you have to declare at some point that it's not going well. You have to abandon. It's not a failure, it's success as well. Now, the plunge is not for everyone. It's a family affair. You need support from your surroundings, your environment, your wife, your children. Financing is, as mentioned in the previous speakers, it's extremely important. You really need to sort out your financing. Do it with someone else. Try to partner. This is a great example where Steve Jobs and Bosniak, and do it yourself. Don't do it yourself, especially in the very beginning. And you have to make a decision whether you go to a big company or a small company. Big company, it's easier in the beginning, but again, you need to, and also you need to know your end game. You need to know when you have to come out of this. So these are the 7 pillars as a clinician I see the future. And I would say, as a surgeon, trying to become an innovator, entrepreneur, made me a better surgeon. And equally, on this path of entrepreneurship, I'm getting a better surgeon as well. So thank you very much for your attention. I hope I can...
Thank you, Christos. A big round of applause for Dr. Kontovounisios. All right, I'll ask one question very quickly. That was an amazing presentation. Thank you so much. So given the challenges and the lack of epidemiological data that you outlined and the need to transform the healthcare system here, what do you see the role of the entrepreneurship, surgical entrepreneurship, in doing so?
Yeah, surgeons are clinicians. They deal with patients day to day, and it has to be a match between different stakeholders. It's the clinicians that they know the needs of everyday, day-to-day practice to improve the services. It's the stakeholders like other scientists, or the government, funding. So it's all about a multidisciplinary team where everybody puts an effort from their background in order to have a good outcome. So there's definitely... in UK, for example, I think it was mentioned earlier at Imperial College, having commercial funding is bad academic output. In Cambridge, maybe it's a little bit different. But being at Imperial, I was performing badly if I had a commercially funded project. This is, I think, we need to change our mindset, and it's all about a multidisciplinary team, I think.
Absolutely. Absolutely. Thank you, everybody. Another round of applause. And that concludes our session.
Thank you, Professor Kontovounisios.